Hi everybody, my name's Heather Gluyas. I'm a nurse and currently I work in academia. I have in the past worked for many years clinically and as well as I've worked in management. And so today what I'm going to be talking to you about is hand hygiene. And you might ask, why hand hygiene? There is so much emphasis given to hand hygiene and really we can't be as bad as everybody thinks we are. However, the statistics and the audits that are done actually demonstrate that we're not nearly as good as we should be with hand hygiene. And yet we've known for an awful long time that hand hygiene is one of the simplest things that we can undertake to drop our infection rates. It was way back in the 1800s when Semmelweis first identified that if doctors washed their hands between maternity patients, that the infection rate dropped. And good old Florence Nightingale actually identified the same things in the 1800s. The more we washed our hands, the better our infection rates. Now, our infection rates aren't as bad as they were in the 1800s. However, there is still significant infections when patients come into hospital, and this needs to be addressed. So, let's talk about hand hygiene. Why don't people wash their hands? Why don't health professionals wash their hands? Well, my experience is that every health professional I've worked with, whether they be a nurse, a doctor, a physio, a dietitian, whatever, every health professional that I've worked with has been committed to good patient care and good patient outcomes. So it seems to me that it's not because health professionals don't care. So there has to be other reasons. And when I wrote the article about hand hygiene for Nursing Standard, I wrote it from the perspective of a human factors perspective. And what the discipline of human factors does, it looks at how people think, so cognition, how they act, and the relationship between that and the environment in which they work and the people that they're working with and the equipment that's available, the technology that's around them, and the interrelationship between those two things. So if we look at hand hygiene from a human factors perspective, we need to examine how people think. So there are three levels or three different ways that we undertake tasks, and they are skill-based, knowledge-based, and rule-based. Now, skill-based actions are those automatic actions, those things that we've done 100 times before and we do almost without thinking. And if you think about that in everyday life, it's when we're driving, when we're making a cup of tea, we don't need to concentrate, we can do those things, although when we're driving we should be concentrating. But a lot of our actions are skill-based actions. Now the thing with skill-based actions is they're very prone to slips and lapses, where we forget to do something or we forget a step in the process. So that could be one reason why hand hygiene practices aren't good. The second type of actions are rule-based actions. And rule-based actions are actions where we don't actually know how to do things automatically, so we have to follow the rules. And they're prone to errors and mistakes if we actually use the wrong rule in the wrong circumstance. So if you apply that to hand hygiene, if we think the rule is that we have to wash our hands when we touch a patient, but we don't have to wash our hands, that the rule doesn't say it's after we've touched the patient bedding, then that would be a mistake. Now, knowledge-based performance, tasks, undertaking of tasks, is done from the knowledge that we have, and we apply the knowledge we have to what we're doing. And that's very prone to mistakes as well. And once again, that can be because we actually don't know when we should be doing when we actually don't have the knowledge, when we should be doing hand hygiene. And that's been sort of validated by quite a few studies, and one of them that I can think of that was done in Australia, where people were asked, health professionals were asked about when, why and how they should be doing hand hygiene, 75% of the time they got it right, 25% of the time they got it wrong. And so that leads to mistakes if people don't know when they should be washing their hands. Okay, so that's 3 reasons why people why health professionals may not be washing their hands. And none of those are because they intentionally mean to. However, there's another group of reasons called violations when people make decisions not to follow the rules, and we call those in human factors discipline violations. And there are different sorts of violations. There's erroneous violations, so that's the lack of knowledge we were talking about before, when people don't have the knowledge and so they do the wrong thing. And then there are exceptional violations, so there are exceptional circumstances. And one of those, or an example of that, might be when somebody collapses and you need to rush forward and intervene, maybe do something, do a clinical manoeuvre, and you don't have time to wash your hands. Okay, so that's a choice. It's not even probably a conscious choice, but that's a choice that people make. The third type of violation are situational violations, and so that might be that there isn't the equipment available. So there's no basins handy. There's maybe only one basin and it's right down the other end of the corridor, and you have to do something to the patient. You're only going to be nipping in and out, so you make a decision that you won't go down and wash your hands, or there may be no soap available, or there may be no hand gel available. Any of those things could lead to the fact that you make a decision not to undertake hand hygiene. And the way we make those decisions, and this is in life outside hospitals as well, is we do a risk analysis. And for example, let me give an example from common day things. How many of you have rushed across a road when the green man has stopped flashing and it's gone to the red man? So you shouldn't be crossing. But you look around, there's no cars coming, there's no traffic, you think, I'm not going to get hit by a car, I'm not going to fall over, I can race across. We think if you apply that to hand hygiene, we think the same way. So if we evaluate that the risk is very low that we're actually going to be causing an infection by not washing our hands, then we may skip that. For very good reasons. There may not be equipment available, we may be overworked and there just isn't time to wash our hands the 5 times as our perception, and the risk is low. The problem with that is the action of not washing our hands is quite removed from a patient getting an infection. So I might choose to go in and do something with a patient when, according to the 5 moments, I should be washing my hands. I choose not to because I think the risk is low. That patient is not going to get an infection in the next 30 seconds. I'm not going to know that my actions actually may have led to an infection that will occur 3 or 4 days later. And so that risk taking, we might evaluate the risk as low because we actually don't see the outcome. So we need to start evaluating that pretty differently. And the other type of violations are the routine violations, where we work in a culture, in a context where people don't wash their hands as often as they should, and so we don't see it as risky, and therefore we don't either. So that was a pretty simplistic and fast go through of the reasons that people don't wash their hands. But until we actually look at it from that perspective, then we can't come up with strategies to actually overcome those things that are leading to people not following the hand hygiene principles. So when you read the article, I'd really like you to go through and read what I've just talked about in depth, the human factors, contributing factors to why people might not wash their hands. And I encourage you to do the learning activities to really, really think about those things and apply them to hand hygiene. And then I want you to look at the strategies. I'm not going to tell you what the strategies are. I want you to read what the strategies are and think about those strategies in terms of your particular practice, but also in terms of what's happening in the work environment that you work. Okay, I hope you enjoy the article. and I hope you find some value in it. And I look forward, if anybody wants to make any comments, I look forward to you contact me in the future. Okay, good luck and enjoy.